Dialectical behavioral therapy is an effective, evidence-based psychosocial treatment method that can be used with a variety of populations living with mental illness to help promote occupational engagement and facilitate recovery. DBT is characterized by 4 distinct skills-based learning components, but today we will be focusing on distress tolerance. Within the realm of distress tolerance, the ACCEPTS acronym, each letter stands for a different technique used to help a client cope with unpleasant and distressing emotions. More specifically, the A stands for activities, and the first C stands for contributing. The purpose of activities is to encourage the person in crisis to distract themselves from distressing experiences by engaging in pleasurable activities. Contributing acts to encourage clients to contribute to their community and others.
Meet Loretta. She is a 34-year-old woman who loves to read books and walks her dog to the park. Loretta has a diagnosis of borderline personality disorder and often experiences negative thoughts, dysregulated emotions, and distressing feelings in response to a variety of external stimuli and life events. Loretta is also recovering from substance abuse disorder, which manifested secondarily to BPD, as a way for her to cope with her inability to tolerate negative emotions and distressing thoughts. This week, Loretta is feeling anxious and uneasy for her upcoming Thanksgiving dinner with a large group of friends. Growing up, Loretta lived in a foster home where family dinners usually ended in arguments, screaming, yelling, and would frequently turn violent. She is currently receiving DBT in weekly individual therapy sessions from her OT who is trained in DBT.
Prior to DBT sessions, the occupational therapist must accept several working assumptions to establish appropriate attitude for therapy. Number 1, Loretta wants to change and is trying to do so, although at times it may not appear so. Number 2, Loretta's behavior patterns are understandable in light of her history and present circumstances. Number 3, Loretta is not responsible for the way things currently are in her life, but it is her personal responsibility to try to make them different. Number 4, clients do not fail at DBT. If Loretta's substance abuse problems do not improve, it is the treatment that is failing and needs to be modified. Number 5, although the OT may feel manipulated by the client, blaming or labeling the client as manipulative will not lead to successful therapeutic intervention. DBT also requires the OT to use opposing communication styles with Loretta. One style is warm, genuine, and responsive, and may include self-disclosure if deemed appropriate and beneficial. The other style is more confrontational and challenging in order to address situations where Loretta seems stuck or appears to be going in the wrong direction. Overall, the OT must be accepting of Loretta, but encourage and nurture change through well-meaning demands.
During the individualized session, the OT will use talk therapy and an open discussion to explain what the ACCEPTS acronym is, as defined within DBT. The OT can then use the COPM with Loretta to identify the occupations she enjoys and could use to distract herself when negative emotions emerge. During the therapy session, Loretta identifies spending time with her dog and reading romance novels as activities that she enjoys, and she mentioned being interested in volunteering at the local food bank as a way to give back and contribute to her community. The OT and Loretta can practice engaging in the occupations that she identified when she feels distressed emotions emerging, using role play and other techniques. Depending on the nature of the chosen occupation, the therapist may also need to explore the feasibility and logistics with the client to ensure that there are no barriers inhibiting the client from engaging in the activities.
Mastering distress tolerance takes practice in order to have success. The OT will provide worksheets and exercises for Loretta to complete before her next session. This homework encourages putting distress tolerance strategies into practice and strengthens her ability to tolerate distress without relapsing and using drugs to cope. The self-report distress tolerance scale will be used pre- and post-distress tolerance training to determine the effectiveness of the ACCEPTS module. Using the DTS as an outcome measure will provide meaningful feedback for both Loretta and her OT and allow for program modifications to be made if necessary. Loretta's Thanksgiving dinner with her friends is this weekend. She feels confident and equipped with new distress tolerance skills to combat her negative thoughts and dysregulated emotions.